Welcome to section 15.5, where we're going to talk about the autonomic plexuses and the enteric nervous system. So what is our autonomic plexus? These are going to be networks of nerves within our thoracic and abdominal pelvic cavities. We're going to see that they contain sympathetic postganglionic axons, parasympathetic preganglionic axons, and some visceral sensory axons. Notably, we will have our cardiac plexus, which is going to include sympathetic axons from the cervical and thoracic trunk. Those will quicken our heart rate. And we will also have parasympathetic axons that are coming from the vagus nerve. These are going to slow the heart. So in a moment, we'll talk about dual innervation. We will have a lot of the organs throughout our body innervated by both sympathetic and parasympathetic nervous systems, and they will have opposite effect. So sympathetic, increase heart rate, parasympathetic, decrease heart rate. Now for our pulmonary plexus, this is going to include our sympathetic axons from the cervical and thoracic trunk that will cause bronchodilation. Remember, we would take the bronchi and smaller bronchioles and open them up so they have a wider lumen in order to increase the passage of air. And our parasympathetic axons, once again from the vagus nerve, are going to cause bronchoconstriction, closing up that lumen to decrease air movement. Our esophageal plexus over here is going to include our sympathetic axons from our cervical and thoracic trunk and will decrease motility, meaning the muscles will be not contracting quite as much, and our parasympathetic axons from our vagus nerve are going to coordinate the opening of the cardiac sphincter, which I know is not pictured right here. I'm going to throw up an image really quick here of the stomach. So here's the esophagus moving into the stomach, and that cardiac sphincter can be found right over here at the junction of the esophagus and the stomach. This will allow an opening of that sphincter so that food can move from the esophagus into the stomach. And this is coordinated when we swallow. The food will move down the esophagus and into the stomach. Now let's talk about our abdominal aortic plexus, which is going to consist of some smaller plexi or divided plexi, such as your celiac solar plexus. We have your superior mesenteric plexus and your inferior mesenteric plexus. These will include sympathetic postganglionic axons from our prevertebral ganglia and our parasympathetic preganglionic axons from the vagus nerve or from the pelvic splanchnic nerves. And these will innervate all abdominal and some pelvic organs. And we've discussed the hypogastric plexus just a bit in our parasympathetic nervous system. This is going to consist of sympathetic axons from our aortic plexus and sympathetic trunk. We'll have some parasympathetic axons from the pelvic splanchnic nerves as well. So the hypogastric plexus has a superior and inferior. The superior hypogastric plexus has more of the fibers from our sympathetic nervous system, whereas the inferior is with our parasympathetic fibers. And what the role is to innervate viscera within our pelvic region. Now let's move into the enteric nervous system, which is filed under the autonomic nervous system. We have autonomic motor and visceral sensory neurons here that are arranged throughout the GI tract. And it's going to innervate the smooth muscle we have in here and some glands. When we look at the GI tract over here, you could see that there's many different layers that make up the wall of the GI tract. And its third layer here has smooth muscles within it that are going to work to coordinate something called peristalsis. Peristalsis is when we are going to utilize those muscles in order to have a wave-like motion where we are moving that food down the GI tract. Now, in order to do this, we have to have nerves telling the muscle to contract, right? So we have two plexi. We have a submucosal plexus. This is also known as the Meissner's plexus or plexus of Meissner. And then in this muscular wall, we have the myenteric plexus. So since we haven't discussed the GI tract quite yet, I wanted to show you a general organization of these layers that make up the GI tract. So the innermost over here is going to be made up of the mucosa that you can see is in the pink. Ignore this for now. We'll talk about that once we actually covered the GI tract. And then second layer is the submucosal layer. That's going to be this layer where we have a lot of connective tissue, our lymphatics, blood vessels, and so forth, and what we're discussing right now, the submucosal plexus. The third layer is the muscularis propria, or this is also called muscularis externa, and that's where we find our second plexus, which is the myenteric plexus, also known as Auerbach's plexus, which is a German name.